Clinically Speaking is our advisor series of short videos featuring clinical updates from Vitality clinicians and experts in their fields.
Welcome to Clinically Speaking. On this month's episode, we're going to be digging into the concept of Prevention 2.0. The health insurance industry has a huge role to play when it comes to supporting the healthy lifestyles of members. So in this episode, we'll be digging into some of our claims data to assess how healthy lifestyles are impacting healthcare costs and the direction of travel when it comes to incentivising healthy behaviour and intervening so that we can support better health outcomes through private medical health insurance.
Health insurance has a significant role when it comes to prevention. Nearly 50% of the disease burden in the UK is preventable. And actually nearly 90% of that is from lifestyle changes alone. So improving physical activity and improving nutrition. A recent study by Public Health England showed that 7 in 10 adults were actually ready to make a change to their lifestyle, and 80% were motivated to do something in the short term. Insurance companies are brilliantly positioned to help this. On the one hand, you've got adults ready and willing to make lifestyle changes. On the other hand, you've got insurance companies who will benefit from having a healthier population in terms of healthcare spend. And in terms of society as a whole, if you provide individuals with those tools and facilities to make those health improvements, you can end up with a healthier society. Promoting better lifestyle choices improves health fundamentally. We've seen from the VitalityHealth data between 2017 and 2021 that actually having those that are heavily engaged with the Vitality program have significantly lower healthcare costs. And this is over 30% in the cases of musculoskeletal, oncology, and cardiovascular disease. Data from Discovery in South Africa has also shown that actually on a survival basis, for those that have been diagnosed with breast cancer or prostate cancer, those that are more physically active before their diagnosis actually have nearly 50% better survival from that cancer after their diagnosis. So really improving your lifestyle really does significantly improve your health, and as a result, the healthcare burden. Sustained behaviour change is hard. We've known that for many, many years, and it really takes a complex combination of nudges and incentives to truly get sustained behaviour change. We've seen within the Vitality program that active rewards and actually weekly rewards for sustained behaviour change makes a significant difference in terms of people's physical activity. The Waitrose healthy food benefit has shown that actually people who engage in that increase their healthy food spend by 65%. But one of the interesting pieces is also the Apple Watch benefit, where it's a differently framed incentive because it is a loss incentive if you don't continue to engage. And that's been particularly powerful and shows actually over 30% more engagement than active rewards alone. So whilst behaviour change and sustaining it is incredibly hard, if you can get the right levels of nudges and incentives behind it, you can actually show significant change over long periods of time. In recent years, we've actually seen an incredible level of physical activity across the Vitality program being maintained, despite all the changes that we've lived through during that period. In 2021 alone, we recorded 57 million physical activity events. But what we have seen is a change in the way people do physical activity. So over that period, we saw a 50% increase in cardio events being recorded. And actually, a lot of that change has been maintained despite gyms opening post the pandemic. So it really has transformed the way people work out. But what we are seeing is that people are still working out at the same level that they were. So recent evidence really suggests that just making very small changes can have an enormously significant impact on an individual's health. From somebody who actually isn't moving a huge amount to just starting a few extra steps each day can really start building up an incredible change in an individual's health. And I think it's so important for us to think about that, particularly through the recent changes that we've gone through the pandemic, where a lot of people became more sedentary than they had done historically, And we've seen an unfortunate increase in musculoskeletal issues associated with working from home and more sedentary lifestyles. So I think the important message is just get started, just get going with something, and it can make a huge difference to your health.